Implement discontinuous measurement procedure. In ABA therapy, discontinuous measurement procedures are methods used to gather data on behaviors that occur at a low frequency or have a duration that is difficult to measure accurately. Unlike continuous measurement procedures that aim to capture every instance of a behavior, discontinuous measurement involves sampling or observing the behavior during specific intervals or time periods. Discontinuous measurement procedures provide an estimate or approximation of the behavior's occurrence and are typically used when continuous measurement is impractical or unnecessary due to low-frequency behaviors or lengthy durations. Discontinuous measurement procedures are used when obtaining continuous data on every occurrence of a behavior is not practical or necessary. They provide a practical way to gather information about behaviors that occur infrequently or have extended durations. However, it's important to note that discontinuous measurement may result in an underrepresentation of the actual behavior occurrence and may be less precise compared to continuous measurement. Common types of discontinuous measurement procedures include 1. Time. Sampling. This involves dividing the observation period into intervals and recording whether the behavior occurs at the end of each interval. It provides an estimate of whether the behavior is present or absent within each interval, such as whole interval recording or momentary time sampling. With momentary time sampling, the observation period is divided into smaller intervals, and at the end of each interval, the observer records whether the behavior is occurring at that precise moment. It provides an estimate of the proportion of intervals in which the behavior is observed at that specific time point. Example: in a classroom setting, a teacher may use momentary time sampling to assess the engagement of students. The teacher divides the class time into 1-minute intervals. At the end of each minute, the teacher quickly scans the room and records whether each student is engaged in the learning activity or not. This provides an estimate of the proportion of intervals in which each student is observed to be engaged. These time sampling methods offer practical ways to observe and collect data on behavior within specific intervals, providing information about the occurrence or absence of behaviors during those designated time points. 2. Partial interval recording. In this method, the observer notes whether the behavior occurs at any point within each interval, regardless of its duration. It provides an estimate of the proportion of intervals in which the behavior is observed. Example: let's say an ABA therapist is working with a child on reducing instances of verbal outbursts during a therapy session. They decide to use partial interval recording to measure the occurrence of verbal outbursts within each minute. During a 10-minute session, the therapist divides the time into 1-minute intervals. At the end of each minute, they record whether or not a verbal outburst occurred within that minute. The focus is on whether the behavior occurred at any point during the interval, regardless of its duration. 3. Whole interval recording. Similar to partial interval recording, the observer records whether the behavior persists throughout the entire duration of each interval. It provides an estimate of the proportion of intervals in which the behavior is continuously present. In whole interval recording, the observation period is divided into smaller intervals. The observer records whether the behavior occurs continuously throughout the entire duration of each interval. If the behavior is observed for the entire duration of the interval, it is marked as a yes or recorded as present. If the behavior is not observed for the entire interval, it is marked as a no or recorded as absent. This method provides an estimate of the proportion of intervals in which the behavior is continuously present. Example: during a 30-minute observation of a child's on-task behavior in the classroom, the time is divided into 5-minute intervals. If the child is observed to be on task for the entire 5-minute interval, it is recorded as a yes or present. If the child becomes off task at any point within the 5-minute interval, it is recorded as a no or absent.